At Isis-WICCE, research and documentation is the foundation of the entire programming framework. So before we do any action, we do a research, especially to find out the prevalence of sexual violence in the community, for us to be able to initiate programs that are responsive to issues within that community.
In the conflict and post-conflict regions, you normally find that the health system is destroyed, health workers are not available, and therefore the women suffer because they cannot get the services.
And we realize that women have different complications around sexual and reproductive health and rights. So within the programming, we believe that to build communities, to change perspectives, we must prioritize the health of women to enable them to participate actively in the rebuilding of their communities. So the cervical cancer screening is one of the things that we have picked up to be a part of the Peace Expo. One, because cervical cancer is one of the major killers for women in the reproductive age, but also there aren't enough information for women to know that it can be prevented early enough if it is detected, but also access to health services is a challenge in the communities.
We should increase the screening and also sensitization in our communities, because what we are talking about, like cancer of the cervix and cancer of the breast, we are now realizing that it is a silent killer. It is a disease which you cannot easily see. Only you realize when it is too late.
When we screen for cancer cervix and we discover in a very early stage, we refer these women to health units where facilities for early treatment of cancer is available. And in northern Uganda here, we have the facility in Soroti, Lira, and in eastern Uganda in Mbale. And I think for Karamoja region, these are the areas where we can refer these women for this treatment.
Peace Expo will look at the cervical cancer screening as one of the tangibles that women can be able to take back home, because it enables them to realize that cervical cancer is something that can be prevented, something that can be cured, and that they have a responsibility as women, together with their partners, to live responsible lives free from sexually transmitted infections, for them to live a life free from cervical cancer.
The training has been really very interesting and the first of its kind here in the Kotido district, because all along such a training has never been in place, and it has really added to my skills as a clinical officer to handle cases of reproductive health, especially to screen mothers who could be having reproductive health problems.
It will make us continue screening in our health facilities, and it will be a continuous service to the mothers within Karamoja, mainly those concerns of reproductive health. So I see it as important because it has helped us to know that most of our mothers has problems, and we are ready to help them, and we have already, even continuously, all other days, we have been screening them.
Government is really empower the women groups. The women, maybe the women, the NGOs, the women's group should be empowered with the training, resources, so that they are able to mobilize themselves, they are able to talk to each other, to themselves.
No to sexual gender-based violence. We want to say no to early marriages. We want to say no to defilement. And then we must all say, please struggle to restore peace and love.
Health is a cornerstone for development. If we are to support women, if we are to improve the economics of the country, of the household and of the communities, we need to prioritize women's health, we need to prioritize community health, and we need to invest in health systems, in human resources for health, and in the health infrastructure.
Government should sensitize communities on gender-based violence and arrange meetings for girls on sex education and how to protect themselves.